Good morning. Today is Saturday, October the 2nd, 2021. Today is a regular Saturday morning yoga therapy class. I'm back to my home in Norfolk again. So I'm in my home. So today's topic is yoga therapy from chaos to calm. What does chaos to calm means from a physician perspective? I'm a physician and I can tell you what the physiological changes from chaos and physiological changes in the calm. Now we tell people this person is calm. You look at the person, look at their face, look at their expression, you know they're calm. Physiologically, it is a relaxation response. It is the activation of vagal tone, like activation of the vagus nerve. A vagal tone is the activation of parasympathetic tone. Parasympathetic tone is called calm and digest. So the word calm is integrated or embedded into the word parasympathetic tone. On the other hand, what we are exposed to in our daily present day lifestyle, it is called fright and flight response, which is a sympathetic overdrive or sympathetic tone. Very interesting. So now you will see person who is practicing a regular, or in our definition is a daily yoga practitioner. You can look at them and you'll say, look at the person. He or she looks very calm, very serene. Look at the way they talk. They don't talk much, listen more. God gave us 2 ears to listen more and 1 mouth to talk less. So if you think, in a yoga therapy perspective, now I always get this question from yoga teacher. I'm a yoga teacher. Every practice of yoga is therapeutic. So what does yoga therapy has to do with the yoga? Nothing. It's not even a yoga, it's called a yoga. As you know, I always tell you, especially the Europeans could not pronounce yoga. So they have to put a 1A called yoga. Yoga means union of your body, mind, and spirit. It's a philosophy, 196 sutras, of which 193 to quiet down your mind. Practice 8 limbs of yoga. If you're a yoga teacher, you memorize the 8 limbs: yam, niyam, asana, pranayam, pratyahara, dharan, dhyan, samadhi. The difference between yoga and yoga therapy is the adaptation of the same practices. based on the patient's or client's clinical condition. To understand that, that's the reason yoga therapy training is about 5 times, 10 times more than a regular yoga teacher. If yoga teacher's training is 200 hours, yoga therapy training is 1,000 hours, 1,500 hours. So as I always tell you, our physical body, in a computer metaphor, physical body is the hardware, mind is a software, spirit is a programmer. Who is the spirit? Spirit is our soul. Who is the soul? Soul is the self. Aham Brahma Ashmi. I am the self. So who is the self? I am the self. So I am the programmer. I'm going to program my software so my hardware will get fixed. So I'm going to take care of my mind through the practice of yoga so that all the bugs on my software, especially bugs in my mind, going to go away. A regular practice of yoga is like your software update. You are doing, if iPhone, you're doing software, iOS, what now? I forget about the 15 or 16, 15, I think, whatever updating you're doing, that's your regular yoga practice, which takes care of your hardware. If you are a spiritual being, you start with the spiritual practice, which is called a spiritual wellness. We call it a downhill course. It goes to your then mental wellness. Mind gets better, then you become a physical wellness. So when you have a coronary artery disease, blockage in the arteries of the heart arteries, the real culprit is your insomnia and sleep apnea, creating a phenomena called psychoneuroendocrinology or psychoneuroimmunology, activation of your sympathetic overdrive, activation of your pituitary adrenal axis, increasing cortisol level, cortisol causing truncal obesity, which ultimately causing your pro-inflammatory molecules, which creates a phenomena called metabolic syndrome, diabetes, hypertension, heart disease, and high cholesterol, or a dyslipidemia. Cholesterol may be low, high triglyceride, and a low HDL. So we are fixing the coronary arteries, we are doing angioplasty, doing bypass. Yes, probably we will need it in acute situation. But to maintain, you need to have the Chitta Vritti Nirodha, quieting down your mind so you'll be able to sleep and won't be able to have any sleep apnea. So let's start a practice. What we find out from a ordinary human being like us, we start with our physical body. If your physical body and breath is not ready, you are not going to be in the state of calm. State of calm means parasympathetic activation. And our Yoga Sutra gave us the asana or the physical posture to become, it's called Sthiram Sukham Asanam. Sthiram is the stillness, Sukham is the happy, Asana is the pose. The moment you enter into a Sthiram Sukham Asanam, the moment you are able to stay in the posture a little longer and longer and longer, not pushing yourself, start like here. I'm sitting here. This is easy pose. I put my feet underneath my knees and put my knees down. If this creates a pain, creates a discomfort, I back off. I start where I am, stay in the posture, create a phenomena called neuroplasticity. Once the neuroplasticity sets in, I'm in a proper sthiram sukham asanam, stillness, happiness in asana. The moment you are in a stillness, happiness in an asana pose, your whole body starts to relax. When your physical body starts to relax, then your internal called involuntary muscle fiber starts to relax. The blood vessel starts to open up, dilate. When blood vessel opens up, the endothelium, inner lining, becomes healthy. When endothelial health is achieved, endothelium releases a substance called nitric oxide. Nitric oxide is the most powerful and potent vasodilator. Endothelial health is our health. So let's start a practice. Let me just take a look at it here. Let's start a practice to see how we achieve this state of calm. First, you will learn how to able to sit down with two components. Beginning. That's a must to be in a state of calm. Able to keep your spine straight. Merudanda Achal. The moment you keep your spine straight, the muscles called paraspinal muscles starts to relax. Doesn't matter what. You sit down in this posture, keep your spine straight. Sit down in a chair, keep your spine straight. Sit down, any asana, vajrasana, spine. You stand up, dandasana, spine straight. You're working in front of computer. Let me show it to you what I do. I have a computer. This is your kneeling stool. Sit down in a kneeling stool in front of a computer and keep your spine straight. That's the way you work. That's the way you work on your keyboard. That's the way you look. This is your level of your screen monitor. This is the level of your keyboard. All of the people are telling me there's a new tradition, sitting kills, moving hills. Yes, sitting kills. But you have to sit down because we are now totally dependent on our computer and sitting down. Even if you sit down in front of your computer, keep your spine straight. Monitor at the level of your eye. 24/7. Drive your car like this. Put your car seat all the way up to the back. Be sure you are straight. You are sitting at a right angle. Sitting in a right angle in a car when you drive. Steering wheel is here. Sit down like this when you're eating use a knife and a fork. And then your breath. Lung is like a balloon. It has a 6-liter capacity. We need 1.5 liter to keep the lung open. We can exchange 4.5 liter. So you have to breathe out. When you breathe out, because normal breathing in, you are doing only 500 cc, half a liter. 90% of a lung has a reserve. Breathe out first. Take a deep breath in. Breathe out longer than breathing in. Breathing out is parasympathetic, breathing in is sympathetic. The moment you start practicing exhalation longer than inhalation, the moment you keep your spine straight, you're starting that process from chaos to calm. What are the other steps? Balancing. We are lateralized. I'm right-handed, right-footed. I'm always using my left brain. Need to use my left side of the body. I'm constantly using my left hand. I wiping my left hand. I'm eating on my left hand. I'm brushing with my left hand. When I started brushing, my even brush won't go close to my mouth. But when you do it, my right hand was doing like this. Now it's comfortable. I shave, electronic shave. I shave with my left hand. Now what happens? I've been all life I'm doing it with the right hand. Now I'm doing left-handed. My right hand sometimes gives me a little bit of a notice. You need to use the right hand sometimes. In our practice, simply I'm sitting down, I just change my foot, activating opposite side of the brain, preparing my hardware. I have seen a lot of yoga teacher, yoga therapy teacher, spiritual people come. We said, we take care of the software, take care of the mind, body get fixed. I said, we are ordinary human being. I need to take care of both. I need to take care of my hardware and software. Yeah, it's like a computer. If you fix your software, it's okay. But your hardware has to be functioning too. And what we notice in all the time, when you get a software updates, that you need a advanced hardware for that hardware to handle the software. Quieting down your mind. Mind is the content of your five senses, and your hand is a connector of your body and mind. If you look at our brain cortex, half of our cortex controls our hand. 1/4 of your brain cortex controls our neck and the head. 1/4 of the brain takes care of my rest of my body. It's called a short man, homunculus. You can go to my book, you can see. So quieting down your hand, the most important mudra is called Dhyana mudra or a Jnana mudra. Touch your index finger and thumb, put it over your. Content of the five senses is your mind. Five senses is hear, you see, you smell, you taste, and touch. Most powerful of all the senses is your vision. Eye is supplied by your 4 cranial nerves. Optic nerve, the retina, SO4, LR6. SO4 means a muscle, superior oblique muscle supplied by 4th cranial nerve. LR6 means lateral rectus muscle of the eye supplied by your 6th cranial nerve. And 5th cranial nerve, trigeminal nerve, supplies the rest of your eyes. Close your eyes. Bring your awareness to the breath. The moment you bring your awareness to the breath, you will see you are in a state of calm. You are state in a parasympathetic activation. We do a lot of practices how to activate vagal nerve. Massaging your ear, closing your throat, trying to blow is called Valsalva maneuver. In yoga, it's called a Korno Rogantar Pranayama. Ujjayi Pranayama. Try to close your throat and breathe in. Valsalva. Breathe out first. Take a deep breath in. And try to blow, closing your nose and mouth. Instant calmness comes in. But remember, The calmness which comes in, it is going to be with you for a while, but then it's going to go away. So you have to continue daily practice. Kapalbhati pranayama, Murcha pranayama, Jalandhar bandha, chin lock with Abhuntarin kumbhak, breath holding and inhalation. But most important breath practice, voluntary regulated breathing, pranayama. I want to pranayama, I want to do a Bastrika, I want to do a Kapalbhati, I want to do a Anulom Vilom pranayama, Brahmri pranayama, Ujjayi pranayama, Shankha pranayama, Pranabha pranayama. You don't need anything. You need exhalation longer than inhalation. Practice it continuously, neuroplasticity will set in, and you will be breathing like that even when you're sleeping. Take a look at a baby. Baby is sleeping. That exhalation is longer than inhalation. Breathe out first. Take a deep breath in. Breathe out longer than breathing in. Have a smile in your face, and you will see what I have now. You will have a saliva in your mouth. Look at my mouth. My mouth is wet now. I've been talking to you. I don't drink any water. When mouth is wet, that means you are having a parasympathetic activation. Breathe out first. Take a deep breath in. Breathe out longer than breathing in. A smile, long exhalation, able to keep your spine straight, and controlling your hand with a hand mudra is going to bring a profound calming effect in the body and mind. What does have a therapeutic implication? All of our chronic lifestyle related disorders, diabetes, hypertension, heart disease, high cholesterol, truncal obesity, all is due to your high sympathetic overdrive, what we call as stress. Stress is a high sympathetic phenomena. So the calm and digest, the moment you digest all of your food, the whole gastrointestinal tract supplied by parasympathetic nerve. The food converts into 7 tissues of our body, saptadhatu. Then it converts into ojas, which is our immunity. Undigested food material, which a toxin called ama, shows up in your blood as a high sugar, high cholesterol, high uric acid. Anything high in your body from chemical standpoint is due to inability to digest the food because of inability to create a vagal tone, parasympathetic activation. When you feel this level of calm and comfort, you progress. Take your one heel to the back, take your other foot on the top, your knees just drop down on its own. This is called your Siddhasana, perfect pose. If it doesn't go down on its own, if it stays up, let it be up. Practice breathing out longer than breathing in, Chana mudras, eyes closed. This thing will happen on its own. If you push it down, it'll come back higher. Nothing. I'm closing my eyes. My attention is my breath. Breathing through my nose, not through my mouth. Always breathe out first. For the calming effect, you do a breath-centered meditation, breath-centered guidance. Remember, once your physical body is ready, when you are in a state of meditation, remember we call meditation is the medication. In a yoga therapy, asana is the tablet, pranayama is the ingredient of healing. Meditation is the medication. Meditation is also the mechanism of action for this yoga therapy. There's a lot of pranayama where you are using your mouth. But see, if you breathe through your nostril, look at, visualize, close your eyes, breathe out first. Visualize your breath. Visualize your breath coming in through your nostril. Your nose is like a filter. It is filtering the outside air. Your nose is like an air conditioner. Outside air is warm, it is cooling it down. Outside air is cold, it's warming it up. Air is going to the side of your nostril called turbinate, which are like a groove and a channel, which creates a vortex. That vortex going over the mucosa of the sinuses, maxillary sinus, frontal sinus, they're all open in the nostril. The mucosa releases a substance called nitric oxide. Nitric oxide is a potent vasodilator. It opens up the blood vessel. Nitric oxide is a mediator of the parasympathetic tone. Sympathetic tone is mediated by epinephrine and norepinephrine. Parasympathetic tone is mediated by nitric oxide, cyclic GMP, acetylcholine. Air is coming all the way down behind your throat, coming to the upper part of the lung, middle part of the lung, lower part of the lung, pushing down the diaphragm almost to the level of belly button. Raising your abdominal wall a little high up, creating called abdominal breathing. Abdominal breathing is calm. Abdominal breathing is parasympathetic. If you look at a baby, baby is sleeping, baby's abdominal wall will go high up with inhalation, go down with exhalation. So if you put your hand, you will see during inhalation, wall will go high up. During exhalation, it will go in. Abdominal breathing is calm. Same way you visualize. When you come to the level of belly button, you take a little pause, which is called cable kumbhak. Again, visualize your breath coming out from the lower part of the lung, middle part of the lung, upper part of the lung, behind your throat. Air is coming out through your nostril. Breath is the carrier of the prana. Prana is a subtle energy which keeps us awake, alert, and alive. Our whole body That's the breathing. Breath is the calming. So we have a common term. Somebody is restless, somebody is anxious. The first thing you will hear, take a deep breath in. I was amazed. I saw two brothers fighting. One was about, I think, 3 or 4, another one just 2 years older, 5 or 6. The older one was screaming at the younger one. The younger one says, brother, calm down, take a deep breath in. I was so amazed. I asked their parents, did you taught them? I said, no. It is their own individual perception that when you breathe in and out, you calm down. Kids will do hand mudras. I just had a baby, a granddaughter. I just see her finger, she's touching her middle finger and thumb, Shunya mudra. She'll be touching, she'll get Dhana mudra. They keep their hands in a mudra all the time. Always they close their hand like this, called Adhi mudra. Or this is called a Balo Mushti mudra, baby. Practice, these are calm because babies are calm. If you breathe in through your mouth, you have no idea where the air has gone in. Air can go to the stomach, go to the lung. Somebody says, I have to breathe through my mouth. What should I do? So then you breathe in through your nose, breathe out first, breathe in through your nose, breathe out through your mouth. This is physiological. So I was asked a question. Breathing is all through your nostril. Why do you breathe in during Sitali Pranayam? Or when you breathe in through mouth during Ujjayi Pranayam? It is not a breathing. It is a practicing pranayama, Sitali Pranayama, to cool down your inner body core temperature, reducing your pitta. This is the practice for your cooling down, not your regular breathing. Your regular breathing, even in awake, even in sleep, doesn't matter when, where, how. You're in a train, you're in a plane, you're in a hotel, always breathe through your nostril. My noses are blocked, I have a deviated septum. Nothing bothers you. What bothers you is a mucus. Babies call them, children call it booger, called a snot. The mucosa inside the nose gets dried up. Daily practice of jalneti, neripat, washing your nostril. Daily practice of putting a little oil inside your nose before going to bed. Naake tel diye ghumai. You sleep through your nostril. You don't sleep through your mouth. The moment you sleep through your mouth, you create a sleep apnea. Sleep apnea is the root cause of our metabolic syndrome, diabetes, hypertension, heart disease, dyslipidemia. So I'm talking to you, I'm sitting down, I'm feeling comfortable. So I do the opposite side now. Same asana, siddhasana, opposite side. Sukhasana, siddhasana. So I'm not going to do a long practice today. I have another program to attend. But I'm showing you, by able to do this, my chaos is going away. I'm getting into the calm, which is calm and digest, parasympathetic phenomena. What other technique do you bring to relax your whole physical body? so you can enter into the state of calmness. Bhramri pranayam, bumblebee breathing. You have five senses, you shut down your five senses, then your brain has a frequency, you create a frequency, two frequency interacts, cancels, called harmonic resonance, your brain and mind quiets down. You follow that with the pumping and cupping. You rub your hands to generate heat. When you put it over your eyes, the eyes take the hit. It relaxes all the intraocular muscles and the muscle called the ciliary muscle. Ciliary muscle pulls your lens tight. When ciliary muscle relaxes, the lens becomes more convex. A profound calmness comes in. All the muscles in the face are attached to your skin. When the muscles are relaxed, all the lines in the face, like your all this, we call it the 11 sitting here, your all the frowning, all the lines goes away. Massaging the carotid sinus here, both sides, relaxes your both parasympathetic activation, quiets down your cardiovascular system, nervous system. Massaging in the back, massages your insertion of trapezius muscle, sternomastoid muscle. So for a Bhramri pranayam, put your index finger in the forehead. You have seen me doing multiple times. You can do the Shanmukhi mudra to close, or you can put your fingers to close your eyes. Use your thumb to close your ear. Then you close your mouth. Breathe out first. Take a deep breath in through your nose. Breathe out with the sound of a bumblebee. Take both the hands, keep rubbing your hands. When you keep rubbing your hands, you feel the warmth in your hand. Take the hand as a cup, put it over your eyes. Let the eyes take all the heat from your hand. The hands, eyes are properly relaxed. Massage your forehead. All the frowning, all the lines will go away. Massage your face. Massage behind your ear. Massage front of your ear. Massage inside the ear canal called external auditory canal. Here is a branch called auricular branch of vagus nerve. It will activate your vagus nerve, vagal tone. Bring your hand on the side of the neck, massage your carotid sinuses. The vagal activation. Take your hands to the back, massage the insertion of your sternomastoid and trapezius muscle, which are both supplied by cranial nerve. I'm feeling a profound level of relaxation as demonstrated by the saliva in my mouth. I'm in stages. I feel a profound level of relaxation. One foot in the top. This is called your Ardha Padmasana, Swastikasana. I hear it all the time. I cannot do it. I used to do it. I have a knee pain. I have a hip pain. Now I cannot do anything. No, you can do everything. You have a knee pain, you have a hip pain, go back. Find a place where you don't have any pain, go back. Start somewhere where you can. Maybe you need to go back exactly when you started your practice. Remember, transformation took place in all of us. Transformation will also take place in you, even if you have a knee pain, hip pain, back pain, all the pains. Pain does not come from the rubbing of the bone or rubbing of the cartilage. Cartilage doesn't have a pain fiber. When your joint is damaged, when your joint has inflammation, body does a splint. Splinting is a way of immobilizing a joint. If you have a fracture, what do you have? You put a plaster cast to immobilize. The nerve fibers are in the ligaments and the muscles. The moment you learn how to relax your ligaments, the moment you learn how to relax your muscles, pain goes away. Put my hand in between all my toes. It's another relaxation. Very calming practice. Do it all the time. Abdominal lock, chin lock, root lock, Mula Ban, Udyani Ban, Jalandhar Ban. Calming. Jalandhar Ban stimulates the carotid sinuses. Reason I'm telling you, I'm giving you the reasonings. You as a yoga teacher, yoga practitioner, understand what the calm means from the medical term. So, even if I have hands in between my toes, I'm relaxed. My neck is straight, I don't bend my neck. I'm doing my regular breathing. Remember, people always ask me, when do I breathe in? When do I breathe out? I said, you can always keep back of your mind. Muscle needs oxygen for work. Before a muscle needs to work, you breathe in. When muscle is working, you breathe out. Normally, in any yoga practice, you breathe, you do the practice completely effortlessly, no effort in your breath, and breathing out longer than breathing in. Neck is straight, breathing out longer than breathing in. Slowly, I drop my chin down, trying to bring the chin touching my chest. I'm doing my regular breathing, breathing out longer than breathing in without any effort in it. Next, I incorporate breath holding in inhalation. It's called Abhantarin Kumbhak. The Sanskrit words corresponding to the English name, inhalation is called Purak. Breath holding is called Kumbhak. Breath holding in inhalation is called Abhantarin Kumbhak. Abhantarin means in, Kumbhak is breath holding. Breathing out is called Rechak, and breath holding after breathing out, which we in English call suspension, is called Bajja Kumbhak. When you do a breath holding in inhalation, the lung starts to expand. Lung cannot expand anymore because lung starts to expand because there is an exchange of the gases, and gases starts to build up. It's like overinflating a balloon. But when the lung comes to your chest wall, there is a rib cage, bone, it cannot expand anymore. the lung starts to recoil back. It's a phenomena called a Herring-Brewer reflex. And when the lung starts to recoil back, that happens due to parasympathetic activation, happens due to calming, happens due to vagal tone. Both breath holding in inhalation and breath holding in exhalation done effortlessly is calming. But when it is done against your calming, like an effort, when you're doing with an effort, it becomes sympathetic and it may going to harm you. It is a very common term in our yoga practices that please do not practice pranayama on your own. Have a guide to guide you for pranayama. Have a teacher to guide you for pranayama. There's no question about it. Who is the teacher? Your teacher is the teacher within you. You have a teacher within you, and your teacher is within you telling you, practice pranayama as if it is your normal breath. Again, coming back and explaining to you, breathing is to bring the oxygen in your body, bringing carbon dioxide out, and also in yogic tradition, bringing the prana inside, and then the breathing takes place in everywhere in our body. Our lung does breathing, liver does breathing, skin does breathing, prana goes to the organ of healing and breath. All the pranayama practices you see through the mouth, Sitali, Sitkari, Shadanto, you name it, say Shankha pranayam, maybe Ujjayi pranayam. These are to practicing to either to get a cooling down inside your body, activating parasympathetic tone, but that is not your regular breathing. Regular breathing is the breath even you are doing when you are sleeping. Breath has a two component, involuntary and voluntary. Involuntary called autonomic. When you are sleeping, that is a function of your brain stem. Voluntary. I can take a deep breath in, deep breath out. Function of my cortex. So I'm feeling that level of relaxation, feeling of calm. And what is going to happen? You are entering into the state of meditation without your so-called meditation practice. I hear all the time, I want to practice meditation. I want to sit down, close my eyes, and follow my breath. It's perfect, fine. But the physical body is not ready. It is going to wake you up, going to a little tingling and numbness, pain. Sitting here, if you get a numbness in the foot, that means you're causing imbalance in your body. Back off. Not even pain. Any sensation you get in your physical body during practice should back off. Mursha pranayam. Chin lock, Jalandhar bandha, the breath holding and inhalation. Abhantarin kumbha. Most calming, most important practice from chaos to calm. It is so calming, the name is called Murcha. Murcha stands for almost unconscious. I've seen people practicing Murcha Pranayam before going to bed as a sort of precondition or preparatory practice for sleep. A lot of interesting stories about this Murcha Pranayama, but Murcha relaxation. Use your hand as an Adhi Mudra. This is also relaxation. Putting your hand, separating your toes is a powerful relaxation. We have done it already. Let's do it in Adhi Mudra. You'll be breathing out first. You'll be breathing out first. Then you will be breathing out first. Then you will be breathing in through your nostril. Then you hold your breath and do a chin lock and counting how long you can hold. Remember, you hold only without any effort. The moment you have any effort, you back off. So breathe out first. Take a deep breath in. Hold your breath. Drop your chin down, touch your chin to the chest, and keep counting. 1 and 2 and 3. See how long you can hold your breath. Wonderful calming practice. If you do Uddiyani Bandh, it's the same. Uddiyani Bandh is very calming. In fact, Uddiyani Bandh, called abdominal lock, reduces intra-abdominal pressure. You get a better perfusion of the abdominal organs. It's a wonderful practice to be calming, to go from chaos to calm. Breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. You can take a deep breath in and out. So I feel very comfortable, relaxed. From here, I can go to my true relaxation asana, which is your Padmasana or lotus pose. Ujjayi pranayam, slowly closing your larynx. Larynx is supplied by superior and inferior laryngeal nerve. Inferior laryngeal nerve comes from the recurrent laryngeal nerve. And I talked about all the anatomy of the vagus nerve. You can go back to my YouTube, you'll see how to activate vagus nerve through different branches. When you slowly do a Ujjayi pranayam and you just inhale and exhale, it sounds like we call it a Darth Vader breathing, or we call it a breathing sound in front of an ocean breath. And when you slowly and slowly can do it, tighten up, you can do more and more. And remember, we always say we do it with our health tracker. My Apple Watch, it's tracking all my health parameters. So we are talking to you from medical perspective and from the science behind it. Slowly, a regular normal Ujjayi pranayama is breathe out first. Take a deep breath in. Completely breathe out. I teach people Ujjayi pranayama is the most calming pranayama. Once I taught a golfer. A golfer is trying to hit the golf ball in a hard time. He's trying to concentrate, more and more concentrate. He misses the swing. I taught him do the completely opposite. Let go. Have the ball in front of you. Just even with the eyes open, you can do, with the eyes closed, just simply do a little Ujjayi pranayama. Hit the ball, it'll hit the ball. Because now we get calming and cooling. When you can go a little bit of a little deeper, which activates your brainstem through the vagus nerve, then output comes through a hypoglossal nerve, glossopharyngeal nerve. It is a wonderful therapy for your sleep apnea. Breathe out first. Take a deep breath in. Completely breathe out. If you get a little cough, is entirely normal, because that's where Ujjayi pranayama comes from. It is so relaxing, you will see automatically you develop a abdominal lock, Uddiyani Bandh. So one of the most calming practice, let's finish today with the most wonderful calming practice, is a Ujjayi pranayama, which is activating or stimulating your vagus nerve. Remember, Ujjayi pranayama, activating your vagal tone. Ujjayi pranayama, incorporating chin lock. Chin lock activating carotid sinuses. Carotid sinus massage quiets down your cardiovascular system and nervous system, and includes a left nostril breathing. Left nostril breathing is controlled by the right brain. Right brain is intuitive, right brain is cooling, right brain is parasympathetic. Let's finish our practice today with a Ujjayi pranayama along with Jalandhar Bandha or chin lock and the left nostril breathing, which is called Chandravedi pranayama. Adhi mudra, that's the most relaxing mudra. Breathe out first. Deep breath in. Completely breathe out. Practice this as a coming. It will be part of your daily practice. It will be part of your neuroplasticity. You will overcome the chaos to come. It'll convert into a sympathetic tone to a parasympathetic tone. You will overcome the chronic lifestyle related disease. Dis-ease. When you get effortless ease, you get a ease. Okay, I have to go in for another program today. Sorry, I have to finish a little earlier, but that's okay. I'm here. This is the first Saturday for October. Second and third Saturdays, I have two programs. Probably I will miss the Saturday morning class. As I said, if I don't have any program, I come to you. Fourth Saturday, I'm going to teach a whole day, a yoga teachers training course. It's called Ayurvedic Yoga Therapy. And we'll do a program here Saturday, the Ayurvedic Yoga Therapy. Thank you again for joining. We'll see you again in 2 weeks. Bye-bye.